Greetings to all my public health friends in Iowa. I'm Ed Ellinger, the Commissioner of the Minnesota Department of Health, and I'm looking forward to attending the 2016 Iowa Governor's Public Health Conference, which is going to be the highlight, except for the presidential election in Iowa, I'm sure. And in 2016, Iowa will be the center place for a lot of political activity. It's also a center place for public health activity. And certainly along with Minnesota, Iowa is central in what happens with public health in our country. And I'll be talking about advancing health equity for all and optimal health for all. It's going to be the topic of my presentation. It's certainly a central focus of what we have in this state, and I'm sure given the changing demographics in Iowa, it's a center point of what you're going to be focusing on. So I look forward to our conversation. I promise I won't tell any Iowa jokes while I'm there, but I would not mind hearing a few Minnesota jokes. So look forward to seeing you very shortly.
Hello, I'm John Auerbach, the Director of the CDC Policy Office. I'm looking forward to attending the 2016 Iowa Governor's Conference on Public Health. I know this gathering of the key public health and policy leaders in the state will include those who are on the front line every day, offering program and service support, critical data and analyses, and policies that prevent illness, injury, and premature death while promoting wellness. While I'm now at the CDC, I was previously a local health director for a decade and a state health official for 15 years. And as such, I understand not only the importance of your work, but also how both satisfying and challenging it can be. I expect to learn a lot from your experiences during the conference. We're now in an extraordinary period in terms of public health and health care in Iowa and across the nation. We're experiencing increases in access to health care that are reducing some of the burden on public health to provide safety net services. We're seeing a move towards value-based contracting that creates the possibility of more prevention services being paid for by insurance. And we're seeing changes in the healthcare delivery system as patient-centered medical homes and comprehensive care, including behavioral health, become more available. Perhaps most importantly, we're seeing changes of significance within public health that very often involve fewer resources and at the same time innovative approaches to working with healthcare and other non-health related sectors, new kinds of data from non-traditional sources, and shifting demographics and patterns of illness and injury. All of these create new opportunities for us to move upstream in our work. This means that we need to think about what's core and essential in public health as we plan for a new and changing environment. I'm sure that at the 2016 conference there will be interesting and important presentations and discussions that help us to better understand and plan for these changes. I look forward to seeing you there.
Denise Stapley, and some of you may remember me or recognize me from a few years back when I was a participant in the crazy reality show Survivor. And I'm absolutely thrilled that I get to come to present to all of you a little bit about that experience and the unexpected gifts I walked away with when I see you next year at the Iowa Governor's Conference on Public Health. I hope when I show up in April that I can bring a little bit of humor and a whole lot of motivation, because the work that you do in your communities is absolutely vital. And as a mental health clinician and counselor myself, I absolutely know that the work that you do makes a difference. So until then, have a wonderful new year, and we'll see you in the spring. Bye.